Hi everyone, welcome to Center of Balance Live. I'm Szenan from Center of Balance, the acupuncturist. Now today our topic is about, I just try to share, is about additional UTI risk factor for men and women. So additional UTI risk factor. So we talk about the cause of UTIs. I think it was last week. Then we discussed about the diagnosis of UTI yesterday. And then we talk about the symptoms of UTI and what is UTI. And tomorrow we're going to go into treatment for UTI. So if you're interested in treating UTI, if you're an acupuncturist, then you want to join the live video tomorrow morning. Or if you're a patient, you suffer from UTI a lot, then it's going to be helpful tomorrow to let you know that how acupuncture, Chinese medicine, or Western medicine could help UTI. Then following, we're going to talk about the prevention of UTI. When we talk about prevention of UTI, we need to know about the causes of UTI and the risk factor of UTI before we talk about the prevention. Then today is the time for us to discuss the additional UTI risk factor. Right. Let me go ahead and share this as a watch video on Facebook. So if you're in here, please say hi to me. Hi, Eric. I can see you. Thank you for joining us. And John, I will see you. Thank you for joining us. And I'm going straight away to say hi to me if you're on this watching this live video, even though if you are watching replay. Would like you to say hi to me, leave some comment down there, introduce yourself with your phone, like that, and follow on. Please give me a thumbs up and share this live video. Thank you. All right, let's start. So, additional UTI risk factor for men and women. First, we're going to talk about for men. The most UTI risk factor for men are the same as those for women. However, having an enlarged prostate is one risk factor for UTI that's unique to men, because we know that prostate, women don't have prostate, so only men have it. So prostate enlarged is one of the factors. So we talk about the causes for UTIs. Anything that can slow down your urine, and you can't pass your urine. Then when the urine retains in the bladder, then that causes UTI, that increase UTI chance. So prostate enlarged prostate, it will cause your urine slow down your urine, and you retain more water urine in your bladder, and that increase the risk for men to suffer from UTI. That's so simple. But what about women? The additional UTI risk factors for women. There are additional risk factors for women. Some factors were once believed to be a cause of UTIs in women have since been shown to not be as important, such as poor bathroom hygiene. Okay, and the recent studies have failed to show that wiping from back to front after going to the bathroom leads to UTIs in women, like previously believed. Okay, now previously we all believed that. Now, now the study say um, it doesn't make sense for the study. Okay, then I still doubt with that actually, to be honest, because what happened with me is we've been educated that way. We've been educated that way, right? So since I have the idea um, ever since my uni. So for the woman, if you go to the toilet, you wipe from back to the front, and that will lead to UTIs. So that's still in my mind. And when I read about this report and say, well, the study has failed, then I don't know now. But it's up to you. There's a study say that it failed, showing that wiping from the front after going to the for the back to the front after going to the bathroom lead to UTIs in women. So I leave it to you. You can Google it, and do some more research about it. But I have a research in here said it failed. But anyway, the short-term urethra. The length and location of the urethra in women increased the likelihood of UTIs. So urethra in women is very close to both the vagina and the anus. The bacteria that may naturally occur around both the vagina and anus can lead to infections in the urethra and the rest of urinary tract. So a woman's urethra is also shorter than a man, and the bacteria have a shorter distance to travel to enter the bladder. So one of the reasons is because the urethra is shorter and it's so close to vagina and anus, and that can lead to the bacteria from those two places into urethra and then reach bladder. So that is one of the cause. Additional factor for the woman to get UTI. Now, sexual intercourse. The sexual intercourse, the pressure on the female urinary tract during sexual intercourse can move bacteria from around the anus into the bladder. Okay. Most women have bacteria in their urine after intercourse, but however, the body can usually get rid of these bacteria within 24 hours. So bowel bacteria may have properties that allow them to stick to the bladder. So yes, I do see a lot of patients, and for those recurrent UTIs, it seems like sexual intercourse is one of the cause for UTI for them. Whenever they have activity of sexual intercourse and they suffer from UTI, I do have patients presented in this way. Okay. Condom used during sex. So non-duplicated latex condom may increase friction and irritate the skin of women during sexual intercourse. This may increase the risk of UTI. However, condoms are important for reducing the spread of sexually transmitted infection. So to help prevent friction and skin irritation from condoms, be sure to use enough water-based duplicate and use it often during intercourse. So this is another factor that is from condom. Okay, right. And another one that is another factor, risk factor. It's actually most women will go through this phase, which is menopause. And after menopause, again. Now, after menopause, a decrease in your estrogen level change the normal bacteria in your vagina, and this can increase the risk of a UTI. Right. So today's live video is mainly letting you know that what is the additional risk factor, and why do we need to know about all these things? You know, after menopause, condom use, and sexual intercourse, um, the shorter urethra, and what else? And main is the enlarged prostate. Because you need to understand as a practitioner or as a patient, once you know all this, if you suffer from UTI or your patient suffer from UTI, you should think about those factors. Ask the question to yourself or to your patient about those factors to find out the cause of UTI. Not until you find out the risk or the cause of UTI, you won't be able to prevent it. So understand this point, this live video today is going to help you to prevent UTI. Right. So we need to discuss it, we need to understand it, and this is so important. So before we talk about treatment, treatment is when you suffer from that kind of disease, in this case UTI, then you get treatment. But especially if you recurrent UTI, treatments only help when it's happened, when you have an episode. What about preventing it? You don't need any treatment if you don't have it. If you stop suffering from it, so you don't have to get any treatment. So this is the important point in here, that you need to understand what is the risk factor on you or your patient that suffer from UTI. Therefore, you will to suggest a solution to prevent UTI that happen to you or your patient. Does it make sense to you? Now, tomorrow we're going to talk about treatment. In treatment, we're going to put it down to 3 different things, like Western medicines, acupuncture, Chinese medicine, okay, and acupressure. The acupressure, you can do it at home yourself, right? Stay awesome, and I love you all. I'll see you tomorrow. Bye-bye. Stop this.